Poor manual handling practice is one of the most common causes of caregiver injury in the healthcare sector. The following patient handling overview offers a comprehensive end-to-end solution for the safe handling of patients with the aim of reducing risk to caregivers. This workflow is for process illustration purposes and is not intended to be used as a training module. The products shown do not represent all products in the range. A complete list of products and processes is available. Safe patient handling starts with the safety of the caregivers. HoverTech International has numerous safe patient handling solutions that enable caregivers to safely handle patients in various situations. We will pick up the story from an emergency perspective, where responders have been called to aid a fallen person. Use a log roll technique to position the patient onto the hover mat. Once the patient is well positioned, the hover mat is inflated using the HoverTech air supply. The inflated hover mat cushions and cradles the patient while air simultaneously escapes from the holes on the underside, reducing the force needed to move the patient by 80 to 90%. The adjustable patient safety straps ensure patient safety during lateral movements. Once the patient is transferred onto the hover jack, you can deflate the hover mat. Using the same air supply system, you can inflate the hover jack starting with valve number 1. Then continue inflating the hover jack with valves 2 through 4. Fasten safety straps and transport the inflated hover jack to the desired location. Inflate the hover mat and push on an angle onto the bed or stretcher. Once the patient is centered on the stretcher, deflate the hover mat. The deflated hover mat can remain under the patient for all-day care. The hover mat can safely be used in radiology and is CT and MRI safe with no artifact or imaging distortion, and without causing radiotherapy attenuation. Caution must be taken to ensure that an extended 25-foot MRI-compatible hose is used in MRI. Even in the most sensitive OR settings that require additional patient care, HoverMat is the trusted name for patient and caregiver safety in healthcare facilities worldwide. To simplify patient positioning using the air supply, the dual-chamber design of the air wedge assists with ear-to-sternal notch positioning. The patient can be transferred from the OR table to the stretcher using the HoverMat. In cases where the patient has an extended stay in the hospital, the Q2 roller is essential for lateral turning. Whether for hygiene purpose or wound care, Q2 roller ensures complete patient safety and comfort. In case of an extended patient stay, the HoverSling repositioning sheet is an ideal solution to assist caregivers in repositioning of turning a patient. The HoverSling split leg is an optimal solution for caregivers in performing vertical lifts to assist patients to sit on a chair or perform lateral transfers. HoverTech, committed to patient and staff safety through better handling solutions.